So incontinence is leakage of urine from the bladder at any time that you don't want to. And I think the most important thing for people to know is that it does have treatments. I think too many people feel that incontinence is a, quote, natural part of aging. And while to a degree that is true, if it bothers somebody, it's certainly something that should be brought up with a physician. Cure is a tough word for incontinence. Urinary incontinence is very well managed with a number of therapies. We have medical therapies, we have nerve-based therapies, and we have surgical therapies that can all be used to manage urinary incontinence. Our goals of treatment are managing symptoms to improve the patient's quality of life. It's tough to cure all kinds of urinary incontinence, but of course our goal is always to make somebody as dry and comfortable as possible. The range of treatments varies in terms of what the patient's symptoms are and what their other medical conditions are. However, there are medical treatments, nerve-based treatments, and surgical treatments that we use to improve and ideally help cure urinary incontinence. Urinary incontinence affects women of all ages. A common kind of urinary incontinence is called stress urinary incontinence. This is incontinence that occurs when people laugh, when they sneeze, when they cough, when they exercise, and is most common after childbirth. So I certainly see this in patients as young as their 30s and all the way up into women in their 70s and 80s. Urgency incontinence is the other most common kind of incontinence that I treat. This is the kind of incontinence that occurs when someone really feels the need to go to the bathroom and just can't hold it till they get there. This can also be common in young patients, even in children, all the way up to patients up in their 70s and 80s. This kind of incontinence, urge incontinence, is mostly treated with medications and nerve-based therapies, and stress incontinence is often treated with physical therapy and surgical therapy.